Sexual weakness symptoms,
Good day,
causes,
viewers.
and solutions.
It's once again our lovely day to Azay Pharmacy. If this is your first time watching us, or this is your first time seeing this video, I please beg you, go and subscribe to our channel so when we drop any video, you can see it and know what we are just being educative about certain conditions and various things we elaborate on. Today, we want to talk about sexual weakness. I said what? Sexual weaknesses. Sexual weakness is also known as sexual dysfunction. So it's a persistent experience during sex or any activity in sex or orgasm or in sexual arousal. That is what we say sexual weakness. And most of the times, people may say we call it sexual dysfunction. They are all the same.
Sexual weakness na yade a edi amanfo nya egu awade bebree egu relationships bebree enya normal sa sometimes it has an underlying cause nema bi a yede edeba te wo say yehu na etima yede we will be able to come together, fight it, then we have happiness and joy in our marital homes and the rest. So, signs and symptoms. Then the people who say, "Oh, sexual weakness," and I say, "It's our problem. No, you are facing it." And you remember, sometimes a man a yomo, but I had then I rampant. Today, you remember, we are representing men. You better hit it or not, Cassie. So I say, if you be premature ejaculation in men. Omo no na if we be so pure say kind of I say bi o ho a ohu oba no ho a ne ho kra nkan na wajam enye sa so a okọ ho a 1 minute because 30 seconds na pa esa ohu ahi chen kwafo ba so eti esa na sem bebre but asa ye kọ no ye be chirechire mu wo sa issue na kwan a be fa so be dey ebetimi ayden abra anase and I said we were able to solve it for you and it was painful ejaculation during sex ogo ho a during sex ne ho ba se bi ne ho ba pain bi wa chire ya ejaculation se bi oba no be ma hia be ma ne ho ba and I said me cancer yeah ne ho sane no I am a yaw be a day. It's a serious one. Say be on pinwe ya no ho ye den ento no. No come over again say you na eno a
Okay, boss.
a doso ti e basa na wan hwe yi a anije dey esa na etutu din ni ade and na etimi cho say o ye dey ko kitchen na ko hohuru nkuku ko ugbo.
There are other men or female that face the same challenges. We have something we call low libido. Only at Tinkano for sex, and there's nothing that arouses the person for sex. And the third one or the last one, I would say, we delay in sex or delay in the interest of ejaculation. Nipano, before the person even have, it takes time before the person even have that kind of ejaculation or even having the desire to release or something like that. Yeah. Because there's what's that? A weakness somewhere that is causing that. So the person is not able to perform well as as expected, or as we the normal men who are representing men in the field of men.
What are the causes of sexual weakness? And as erectile dysfunction. Causes no ɛwɔ bebree ɛwɔ physical conditions ɛwɔ lifestyle psychology and other things ti yɛfa physical conditions na ɛna sometimes some yadeɛ tumi de ba heart disease ɛka heart disease akoma yadeɛ hypertension mogya borosoɔ diabetes a yɛmfrɛ no ɛnitwi asikyire yadeɛ yɛfrɛ bibi hormonal imbalance ɛhɔ na mɛhete ɔnkɛse obi wɔ hɔ a ne hormones na ɛwɔ ne mu no bi wɔ hɔ a due to some stress bi anaasɛ some kind of ɛyi bi nti na wayɛ depressed ɛtumi ma hormones no yɛ dɛn ɛho tɔkyema sɛ ɛkɔyɛ imbalance a nipa no until sɛ obenya maybe supplements anaasɛ obenya testosterone supplement a bɛma na ayɛ dɛn ne immune ne saa ne hormones no ase aba back to normal no woyɛ no hwee ɛnyɛ yie ɔba aprɛ no ɔmfiw ɛnyɛ ɔnoa n'adwene no ɛkleke koraa saa side hɔ no ɛnyɛ dɛn ɛnkleke saa te ase yɛka hormonal imbalance a mmaa so ɛwɔ ɔma side mmaa no asɛ bibi wɔ hɔ a ɔmo wɔ beard ɔbaa bi a ɔwɔ abɔgyesɛ ne bo so ɔwi saa mmaa no woyi mmaa 100 a emu bɛɛ 10 pɛ ɛna ɔmo bi bia yɛ okay bɛɛ 90% of ɔmo bi wɔ hɔ a ɔmo menstrual issues ayɛ na ɔmo wɔ menstrual issues ayɛ na mmarima hormones yɛ dɛ ɛwɔ ɔmo mu nti ɔmo hormones no sometimes ɔmo sɛ sometimes yɛte ɔmo ase obi a ɔte saa no ne hormones are imbalance you have to take them through some processes so wode ɔmo bɛto aduro so a ɛbɛ balance ne hormones no ama na aba bɛyɛ dɛ bɛyɛ normal yɛwɔ test a ɛyɛ for saa hormones no bi wɔ hɔ a bi wɔ hɔ a ɛyɛ dare wohu yɛ a ɔka ne symptoms na ne wahu sɛ no this is that bi wɔ hɔ so ɔhwɛ no ɛyɛ ayɛ some way a wobɛtumi ama no ayɛ dɛn akɔ lab na wakɔ akɔyɛ hormonal test a ɛbɛshow sɛ o ne parameters no wei wɔ soro wei wɔ fam wei si then na akyerɛ nneɛma a yɛde ma wo a wobɛyɛ dɛn wobɛyɛ okay.
So as my brother said well and explained everything clearly, I think I also talk about psychological factors. Psychological factors, we can talk about stress. We can talk about depression. Depression, a bit why Obi maybe in a relationship, or going through a lot of stuffs, and those kind of relationship problems, the person can face some of those sexual weakness because so a person will have this sex and any kind of this and the person thinks about the past experience or
some trauma
so trauma or go through in the past relationship. Yes, a cabi or the and someone made her to go through some pain. It may cause some of those things and some mental conditions like schizophrenia and also a mental condition which can also cause some of those stuffs. And yes, I can also break down your sexual desire or even your activeness in sex. And even, as I said, your past relation or marital history can also be a problem. Because Senipana, maybe once you were being married, your husband was one of these killer boxer who is a man that usually has a punching box or a punching bag. Yes. So yes, Anna, more times when you meet the next partner, you have that fear that at least maybe it could happen again. It could happen again. The person may harass me, the person may beat me, the person may even put me into pain.
Bad flashbacks.
So all those bad flashbacks, that may weaken the person's even mindset. At least feel free. Come approach us. Let's have one-on-one talk. Then you can tell us your problem. Then we can give you solutions to that. Right now, I want to dive into the solutions and see how we can give a good treatment for someone who has sexual weakness or sexual dysfunction. That's what I may say. So one, I might say medications. We have medications, we have lifestyle, we have therapy and consultation, we have counseling, other things that we can even talk about. But first, let me talk about the medications. The medications, we have other medications we can take to boost your your sexual hormones. Yes, for you to be active in bed or active in sex. Some of those things can be Viagra. Viagra are medications that you take, but don't abuse it, my brother. They are Viagra that you take to boost your hormones in performing in bed, so that at least
the blood flow.
increase the blood flow to the penis, so it can be able to release well, so you can represent men when you are in the field of the work. And the other one we can talk about, what is that? This other medication, sildenafil. Yes, we call that one sildenafil, or even letter.
Yeah.
Yes, that one. Yes.
This has reminded me of one point, especially in men. Those, at first we mentioned some medical conditions that causes erectile dysfunction, which some of them happen to be hypertension, high blood pressure. Some even in the mood, so when you take the high blood pressure medication, though it's true, some of the medications, those are the side effects. That's erectile dysfunction. But when it happens like that, that's the reason why manufacturers have also come out with men boosters. Boosters for men. I bet my boy my wire there. Oh, fast I be pindu no crana. Still now wire there. Like side effect now you can. One year there. Winya. So what I say. A be me or when neck man capsule. What I say.
These are gummies.
Gummies. Also honey goat weed, manpower. Where man, any be a ginseng won't be you see. This is Hunterman ginseng. A multivitamin. And as also a boy then a boost to system no. Emma, you perform as a man, where man, so drugs really nice, and man, so what I say. You know, the can't consistent immune boosters. Etimi boa Emma where the ujina on also as a brand, so what I say. And a two, you see a therapist and a counseling. There was sex therapist for almost so almost an equal sebi sex and who a whole tactics. So sometimes never we say they're serious. You shouldn't feel shy. So what I say, but sex therapist. There are people who are specialized in that. So what I say, or maybe some questions, or who may be an issue near them. If feedback also true for. Sex therapist.
Dr. Oncology.
Oh, technologist or who are better or better to this is all just by the way. So what I say, and you see counselors, which I'm branded the kind who past relationship or firm some trauma be I was say tenacity near cycle. The man who said no, they come in there, they come co. Nyaka na bomb. But imagine say we past relationship meeting. Be a nipa wa question on tisa. But now what they I said, what channels are before no nessa and money that be share we are. You are doing a big mistake. Lack of communication in our sexual homes, our marital homes, in our relationships. Who know bit it? Oh, Benya, oh, Nkadua na Jua on shot idea be a whoopee. I think I won't country. Oh, she we, oh, we see on the mania then, edge. Now, won't come. Oh, or bass will be a guy, no, but who say, oh, we see on a mania then. Me pet, ye say, mammy, Simple are you a bit, mamma, will say, I say, oh, Debbie and a bearman who sugunu, and I saw Barnu sugunu. So what I say, why can your new style be? Feel free, catch you. Yes. What I say, catch you. Obano, catch your bearman also catch your bano. And you move no more at that time. You want to have a better so we enjoy and answer we a good girl and a good boy. So what I say, now the behind there, street answer.
We still hit on the point that we talk about cognitive behavioral therapy. So, in short, CST. And you get someone who can at least ask you questions about your cognitive, your past experience, your past history, about your sex life, it still goes down to meeting a counselor who is going to talk to you about how your past life or how your sex life is. And when cognitive, they talk about things that will guide you and even encourage you to do certain stuff to perform well in your sex life. As he said, in case you have a partner and you want, oh, today probably you want to have a sexual intercourse or something in that day. With that day or a call, oh, sweetie, I'm passing by. Please
Prepare the
prepare the
atmosphere.
atmosphere. Use some languages, use some jargons, use some terms. So at least when you are going, you wear your red flag, you wear your Cavani shirt,
And then let me buy
and all
India,
those
bro.
things. India, bro. At least your all those things, there are things that will motivate you or even put you in the mood before the
Sure.
person will come. And the last one, others, when we are not able to do all these stuffs, we go in for something called vacuum and what's that? Vacuum ejaculation
Device.
vacuum erectile device. You know, it's a device that we use for what's that? To clear
All the sharp.
Yes.
All the sharp. A pump it. Emma Muja the flow need to me back the penal side. Emma Muye yere kama.
That's when we talk about the penile implant and for surgery. That's what I'm saying. Our brothers who are up there, who are dealing with the real hustling and real shit about all those stuffs. They are those people we're talking about. They go into more about the sex or even the drive of the male organ or the female organ. So that penile implant is a surgery that they do for you to motivate to correct it. So at least you can perform as a man. And what I can say, all this we've said, if you have anything that you understand, please leave it under the comment and we'll get back to you ASAP. Keep it 100. Life is short, my brother.
Confirm.